This video is for informational purposes only and does not constitute legal, financial, health, or medical advice. Why documentation is part of good patient care. What if we told you that poor documentation in healthcare led to 1,744 preventable deaths in just 5 years? That one missed note could mean the difference between life and death. Today, we're diving deep into why documentation isn't just paperwork, it's literally a matter of life and death in healthcare. Documentation is the backbone of medical care. Health is a continuum requiring integration across practitioners and facilities over years. Comprehensive, holistic care depends entirely on proper documentation. The vital role of documentation in delivering quality patient care. Patient care involves every staff member from intake to discharge. Each interaction affects prognosis and future health. Consider a simple clinic visit. Registration, triage, forms, consultation, diagnosis, medication prescription, pharmacy visit, and billing. Multiple complex steps create a seemingly simple process. Without proper documentation, remembering specifics becomes impossible for everyone involved, including the patient. 3 main reasons documentation is important in healthcare. Proper documentation provides critical benefits across 3 key areas: protecting the healthcare program, the patient, and the medical facility. 1. Protection of the program. Every facility has unique protocols based on current healthcare trends. Accurate documentation determines if programs work effectively or need improvement. Reports guide decisions about system modifications or complete replacements. 2. Protection of the patient. Patient well-being is healthcare's most important element and should drive proper record keeping. All practitioners want patients to receive appropriate care. Documentation ensures this happens. Comprehensive care involves various medical staff throughout diagnosis and treatment. Medical history and visit records determine optimal care approaches. Example: a patient reports blood and phlegm. The physician conducts physical examination, documents preliminary findings, and orders tests: blood work, bronchoscopy, chest X-ray, and CT scan. Different departments handle each test, documenting findings for the attending physician's review before diagnosis and treatment recommendations. Proper documentation ensures patients receive appropriate medical procedures and treatments. 3. Protection of the medical facility. Documentation protects facility livelihoods from support staff to doctors. Proper records ensure timely payments, correct insurance claims, positive patient experiences, and strong reputations. Documentation also provides legal protection against malpractice suits. Accurate records and thorough reports serve as critical evidence in legal cases. Legal and ethical considerations: how documentation supports patients' rights and safety. Every patient deserves proper medical care. However, a 5-year study found that 1,744 deaths could have been prevented through better staff communication. One case involved the nurse failing to report post-operative abdominal pain and dropping red blood cell counts, signs of internal bleeding. Poor communication led to patient death from hemorrhage. Proper documentation at each treatment step could have prevented this death. The nurse should have immediately recorded observations in a central system accessible to all healthcare personnel. This incident resulted in malpractice litigation. Conversely, proper documentation can provide legal defense, proving facilities did everything possible to save patients. Documentation best practices, strategies for effective and efficient record keeping. Healthcare documentation requires thorough, accurate recording. Here are essential best practices. 1. Document everything. Returning to the malpractice example, the experienced nurse likely considered post-surgery abdominal pain normal. However, efficient record keeping requires documenting all observations, even seemingly mundane ones. Records must cover entire medical experiences for comprehensive, holistic care. 2. Set up a central repository for documentation. Documentation means nothing if the right people can't access it. Digital central systems should store all patient information, diagnoses, and treatments over years. Customer relationship management systems aren't just for retail. CRM in healthcare enhances patient experiences while allowing physicians to access records instantly. 3. Train staff. All facility staff must understand documentation software, however, maintain limited access to prevent over-reporting and malicious activities. Use standard language and terminology to prevent miscommunication. Documentation in the digital age, exploring electronic health records, EHR, and benefits. Paper documents, folders, and steel cabinets are obsolete. Healthcare facilities must embrace technology for better patient care. Software streamlines workflows through easy central system access. EHR isn't just digital filing. It integrates evidence-based tools helping practitioners make optimal patient care decisions based on global situations from other facilities. Technology and internet connectivity can dramatically improve healthcare. Future blockchain developments will further enhance patient care. With proper information and knowledge, medical facilities provide excellent patient care. All healthcare providers must document every step of patients' health journeys. Efficient software elevates healthcare quality. ISI technology provides essential tools helping medical facilities deliver better holistic medical services. The stakes couldn't be higher. Proper documentation literally saves lives. What's your experience with healthcare documentation? Have you noticed differences between well-documented and poorly documented care? Share your thoughts in the comments below. If this video showed you just how critical proper record keeping is in healthcare, hit that like button and subscribe for more deep dives into healthcare systems. Share this with anyone in the medical field. They need to see this.